So I'm going to tell you guys a little bit about our product, UMOVE. It's enabling self-initiated movement sooner, easier, and more accessibly for patients living with mobility disabilities that are lifelong, specifically pediatric patients. So this is me and co-founder David. He has his master's in electrical engineering, and I'm just a university student in mechanical engineering at U of A. This was us at Innovation for Health 2019. This is where the concept for our product came from, actually from the Glen Rose Rehabilitation Center, specifically the ICANN Center. So the ICANN Center serves pediatric patients that have mobility disabilities, mostly with cerebral palsy, but also others here in this list. This is what a typical patient will look like going in there. So a patient like this affects about 200,000 people that are in Canada. When they're in their manual chair, they have non-independent movement, which means that they need someone to help them out, move to where they want to with their manual chair. It has a very complex kind of configuration from seating to angle, as you saw in the earlier photo. At some point, they'll want to move to a power chair. What this looks like is they'll have a meeting with the clinician to kind of evaluate where they're at. Power chairs are quite expensive and quite powerful, so they need to make sure that they're able to handle that at such a young age. So this is kind of where the issue came from the clinician, is this switching over can take up to 45 minutes from switching the complex seating to the power chair, 45 minutes, and then about 5 to 10 minutes for testing, and then 45 minutes for getting them back and ready to leave the hospital. So there's three main issues with this. The patient becomes apathetic with the process, as any kid would. Sitting there for 45 minutes in a hospital isn't very fun. And then getting to try out this new technology that can kind of be confusing also isn't really the best process. Also, the conversion is not one size fits all. As you can imagine, there's many different manual chairs, many different power chairs. Converting all these seating arrangements can take a very long time for the clinicians, and it's a lot of labor intensive. And also it's quite expensive for the hospitals. They have to have about 8 chairs to produce the kind of different versions of power chairs that's on the market right now, and they're about $30,000 plus each for different models. So the hospitals have to be able to maintain these products as well. So this is our prototype to solve this issue. It's this kind of like cart is kind of the best way to describe it, where you can roll on the manual chair that the patient is currently in with their current configurations. And then you can lock it in place just like you would on a bus or on transit. And then you're able to hook up any type of like movement device that you would want to. I don't know if this video is playing on your guys' end, but basically you're able to use like a joystick, sip and puff machine, any kind of machine that you normally would. It moves just like a power chair would in normal senses. So that's kind of like what our solution looks like. Speaking about like market and our goals in the future,
We're just over 3 minutes, so
okay.
Just give us a quick update on where you're at.
Okay. Yeah, so like where we're at right now, there's no device like it on the market right now. So we're just working on, we made a prototype. We're meeting with the clinicians at the end of September to get feedback for V2. After that V2 is developed, we'll be reaching out to relationships with big mobility companies. Hospitals are kind of a zero risk situation, so it needs to come from a big company rather than a startup. So you kind of need to be a product in their catalog rather than anything else. But what we're looking for today is some funding for the V2 and be able to kind of reach out to bigger, larger mobility spaces. This is our contact. Thank you for your time.
Yeah, Tyler, thanks again. Another student team. Really impressive stuff. You built this thing, or you got the idea during a hackathon. Did you build it as part of the hackathon, or what was the build out?
Yeah. So the hackathon is 6 weeks long. You get the idea from a clinician that is identified an issue in their field, and then they pair with science and engineering teams. You have 6 weeks. Our parts didn't, like, for the whole thing, from design, from conception and everything. Our parts didn't actually come in for a week. So me and David spent about like a week sleeping on the university shop floor, building this thing, and to get it ready to get shipped to Calgary for the competition.
Nice. Okay. Well, very impressive. I think we'll call it a wrap here, guys.